Hi, welcome back to our channel here, and let's continue on the discussion of PCOS. Now, PCOS is polycystic ovary syndrome, and it is the most common form of gynecological disease that women have in their 20s and 30s. It is incredibly common, and we've identified that it's caused by this abnormal presence of defected ovarian cells. They tend to release these testosterone instead of other hormones, and they release excessively. So how we treat it is simply by removing these defected cells, and we've already matured this type of technology, and we have been offering this treatment for the past 20 years. So what is the main characteristic of PCOS? What makes it so common and what makes it so easily diagnosable is because of the high levels of testosterone, specifically free testosterone, that is allowed to women to actually develop these sexual characteristics of high testosterone males. So what are we talking about here? The symptoms are usually very easily observable, especially for those in the medical field. PCOS is very easily diagnosed. Sometimes we just need to do another ultrasound and blood test just to confirm it, but to a trained eye, especially a trained doctor, just by observing the physical symptoms, we can easily tell whether a patient has PCOS. So PCOS distinct characteristic is high testosterone. And what does high testosterone do in these cases is that it lets you develop these exaggerated sexual characteristics. So firstly, we are looking at excessive body hair, especially in the mustache area. Some tend to grow hair here as well, and they have hairs over their arms and legs. So this is quite visible as well. And if you see women with this type of characteristic or symptom, it could be a cause of high levels of testosterone related to PCOS. Secondly is that women who have severe acne all over the face and including parts of the body as well, even the arms and legs in the extremities. High testosterone is very closely linked with presence of acne, and this can be another indicator as well. Thirdly is that they have rough, patchy skin and also voice, very similar to how when puberty arrives for boys, their voice start to get deeper, and then their skin start to get rougher and thicker. And this is occurring in PCOS patients, which are girls in their puberty age as well, or even in their 20s. Next up is that they tend to have excessive body fat, which means there's a cause of insulin resistance caused by this excessive high levels of testosterone. So these types of women, they tend to get fat easily, and they are unable to lose the weight because the core reason is not because of their diet or their lack of exercise. It's actually caused by the high levels of testosterone. That is why treatment is so important. When we actually drop the level of testosterone, you lose the weight instantly or very easily compared to how you are struggling to lose it, and they tend to just keep the same body weight, the same amount of body fat, no matter what you try, because the root cause is hormonal, endocrine, high levels of testosterone. And next up are some symptoms that are much more psychological or mental. For example, they tend to have violent tempers, violent mood swings. They also have, they are easily irritated and annoyed. They tend to pick fights with people. They're not so calm, and they're not so collected as well. This is another indicator where if you can observe women around you who have these types of characteristics, there is usually a underlying hormonal balance. And if you see other symptoms that I've described together, then you can easily diagnose them that they have PCOS. Now these are just some of the symptoms, and PCOS has up to 21 clinical symptoms and up to 4 to 5 different classifications as well. And they are all linked to these high levels of testosterone. So this is what it can do to women who have high levels of testosterone. Not only do they develop these male characteristics, these male secondary sexual characteristics, they tend to also lose the ability to get pregnant because ovulation is disrupted. So before you go for pregnancy or marriage, please receive treatment first for your PCOS if you are in fact diagnosed. Do not rely on medication as they are only short-term solutions. You will still need to remove these abnormal tissues within the ovaries to achieve natural unassisted pregnancies and also to increase quality of life. Please visit the website, the link below, and also leave me some comments down below as well. Stay tuned to the next one.